Knee pain can quietly steal freedom from everyday life. For many patients, pain affects only one side of the knee.
Hello, today we'll explain how partial knee replacement can restore movement with less invasion. When arthritis damages only one compartment, full knee replacement isn't always necessary.
Partial knee replacement preserves healthy bone and ligaments.
This surgery is ideal for selected patients with localized knee damage.
The journey begins with a detailed orthopedic evaluation. Imaging confirms damage limited to one knee compartment.
Correct patient selection is the key to long-term success.
On surgery day, safety and comfort are prioritized. Spinal or regional anesthesia keeps the patient pain-free.
The procedure room is sterile and precision controlled.
I understand.
You're in good hands.
The orthopedic team prepares with strict sterile protocols.
Partial knee replacement is a proven, safe procedure.
The knee is positioned to access the damaged compartment.
A smaller incision preserves surrounding tissues. Only the damaged area is exposed. Worn cartilage is carefully removed.
The bone is shaped to fit the implant precisely. Accuracy ensures natural movement and long plant life.
Trial components check alignment and balance.
Ligaments are preserved and balanced.
The final implant replaces only the damaged surface. This insert allows smooth, pain-free motion.
The incision is carefully closed.
The knee is protected with sterile dressing.
The procedure is successfully completed.
Recovery timeline, weeks 0 to 6, activity level is low. From weeks 6 to 12, increase to a moderate level.
The patient wakes comfortably in recovery. Post-operative pain is well managed.
Your recovery is on track.
Movement begins within hours. Okay, I'll try.
Most patients walk the same or next day.
Recovery is often quicker than total knee replacement.
Patients return home sooner.
Regular checkups ensure healing.
Before surgery, pain limits activity. After surgery, movement feels natural again.